Tate Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world, from border to border, coast to coast, and to all the ships at sea, I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in today to the Tate Chronicles. Join me as we cut through the fog that exists at the leading edge of healthcare delivery, technology, and policy. My guest today is Debbie Condrey, Chief Information Officer for the Sequoia Project. The Sequoia Project is a nonprofit independent advocate for nationwide health information exchange and a critical player in the march toward interoperability. Debbie has over 30 years of experience in information technology, and she was the CIO for the Virginia Department of Health. This depth of experience makes her a perfect guest for the Tate Chronicles today. Debbie, welcome aboard.
Well, thank you so much, Jim, for having me today. I appreciate that.
Debbie, the span of your experience allows you to have a unique and really comprehensive view of the trajectory of interoperability. So that's one reason I was really glad to have you here today. The 21st Century Cures Act, which was passed in 2016, it's been 6 years, called for the development of a trusted exchange framework and a common agreement. That's what we now know as TEFCA. And it looks like the Sequoia Project has a very large role in TEFCA. Can you tell us about that role and what are the responsibilities of Sequoia?
Certainly, be happy to. Thank you for the question. So yes, you're correct. The Sequoia Project was selected by the Office of the National Coordinator in late 2019 to become the Recognized Coordinating Entity for implementation of TEFCA. And TEFCA, as you mentioned, is the Trusted Exchange Framework and Common Agreement. So that is developed and implemented through the RCE, which is the Recognized Coordinating Entity again, and ONC. And the RCE is responsible for working collaboratively with the Office of the National Coordinator to implement this trusted exchange framework across the country and produce certain deliverables such as a QTF, which is a technical framework for connecting to TEFCA. It's also responsible, the RCE through Sequoia is responsible for creating the common agreement. So the common agreement is a framework for trusting those who are exchanging health information across the country. This TEFCA framework does impact those who are exchanging health information now and in the future. It also, there are several use cases that apply to this framework, including public health and state agencies who are involved in exchanging health information as well. So it's really far-reaching.
And so there are going to be a number of these, as they're called, QHINs, Qualified Health Information Networks. And we're at the point where the agreement and application process for different entities to apply, and I guess it is their desire to become one of these Qualified Health Information Networks. And so what we're talking about then, it sounds like, is a overarching network of networks that will be able to exchange that health information.
That's correct. So obviously there are health information exchange networks, both statewide, state health information exchanges, and national networks as well in existence. eHealth Exchange is an example of one at a national level. Commonwealth is an example of another. The QHIN will be, Qualified Health Information Network, will be sort of a network of networks, as you mentioned. And they're sort of a super network with additional requirements around security in terms of exchanging data, access to information, so that the exchange of information across the country is facilitated in a more secure and trustworthy way. So obviously TEFCA creates a sort of a common set of principles and conditions that support that kind of health information exchange so that consumers can access data as well. So there's a piece of TEFCA as well that applies to consumers and access to their own data.
You know, there was a a series of these large steps in interoperability. I don't know, maybe it was 20 or 25 years ago, we saw the first regional health information RIOs, they were called, and then we had the HIEs, Health Information Exchanges. A lot of these were on a state basis or some geographically related basis, but there was really no widespread national network. And so the fact or the desire is that for these QHINs, and I guess none have been announced yet. There's an application process. As far as I know, we don't know how many they're going to be. They will be able to exchange information. So providers, hospitals, those kind of entities will connect to one of these QHINs. And because the QHINs are connected, it's like a one-to-many type situation.
That's correct. That's correct. It does. Yeah.
Yep. Go ahead. Please go ahead.
I was just going to say it does create an access to data exchange at a higher level, national level, obviously, than, as you mentioned, RIOs, the Regional Health Information Networks, and HIEs, which there are several state HIEs, obviously, still in existence, but they're limited by their exchange cross-boundary of states. So the national networks obviously have kind of broken down that barrier that are in existence now in terms of the cross-boundary exchange of data across states. And these QHINs will create an even more elevated environment for the exchange of health information. So it's an opportunity, I think, to really get to the point where we're able to provide the right data at the right point of care for patients for better outcomes.
One of the things that I was glad to see when I was reading through some of the documentation is that TEFCA, I guess the foundational use case, workflow, technology, whatever you want to call it, had to be backwardly compatible, so that the existing HIEs and other networks that are out there don't get thrown to the side because they're legacy systems. Because there's a lot of data already out there in those systems.
That's correct. In technology, we call, we do this thing called rip and replace. You just rip it out and replace it. That's not at all what this is. This is building on existing frameworks and existing interoperability that has been working well. This is just, as I mentioned, elevating that to a higher level.
One of the things that I'm really excited about, I was at the HIMSS conference a couple of weeks ago in Orlando and sat through a lot of presentations on TEFCA. And there's obviously been, since the Cures Act was passed 6 years ago, so much planning and work to get to the place we are now. And it seems like 2022 is when we really start to see this coming out of the ground, so to speak, with the impending, at some point, announcements this year of the initial QHINs and the flow of data.
Yeah, that's correct. The application process, as I understand it, will start sometime later this year with those who are interested and qualified to become QHINs expressing their interest through a qualification process. So we'll see what happens with that. We're hoping that we have some good interest, and I think we will.
I think we will too. Initial traction, and then that reaching that critical mass, where Correct. It just becomes part of a provider's workflow. And there's certainly a lot of information on the internet about TEFCA, but one of the places that I found good information is just at the Sequoia Project website, and that's Sequoia, like the tree, SEQUOIA Project, sequoiaproject.org. A lot of frequently asked questions about TEFCA can be found there. Sometime in the future, Debbie, maybe we'll go into much deeper detail on TEFCA, but also in this discussion with you today, I want to talk about the recent 2022 Preparedness Summit that was in Atlanta. I know the Sequoia Project participated, And can you tell me what this Emergency Preparedness Summit was really all about?
Sure. So the Emergency Preparedness Summit that's in Atlanta has been happening for many, many years, and it's convened by a national organization that represents state agencies, public health, Medicaid, emergency preparedness, and others who are responsible for sort of boots on the ground emergency response and preparedness, especially during something like the pandemic that we're going through. Mm-hmm. So the conference has been held in person, obviously, in the past. It was not held last year. So this was the first time it was back in person in Atlanta. So Sequoia was invited to present and participate, and it was well attended. I think it's definitely an area that there's a lot of conversation, and especially at the federal level, and funding coming out of the federal level for modernization of IT systems, and especially on the public health side of the house around emergency preparedness. So Sequoia was there presenting on the recent deliverable from our Emergency Preparedness Information Work Group.
One of the things that I've thought a lot about, because I'm interested in healthcare data and interoperability, is during the pandemic, and hopefully we're in the latter stages of it, even though it's still omnipresent. National health policy had to be based on data. And a lot of the data that was being received, at whatever level, but certainly at a national level where policy was being done, was based on really seemed like fuzzy data. And not to bring fault on anybody, because the goal was to get as many shots, many vaccinations as possible in as many arms as possible. And so as that was taking place, a lot of demographics were not being captured on people who were receiving those vaccinations. There probably is still not a national list of who got vaccinated. And different regions, different states reported different levels of quality of data. I've come out of a world of certification of health information technology. And for years, as these technology firms would have to pass certification for immunization or public health surveillance, things like that, they'd always say, well, why do we have to do that? And our answer would always be, well, if we ever have God forbid, a terrible pandemic, we'll be ready to report. We thought we were okay, but in some ways we were blindsided, I believe. I don't know. Maybe it was the speed of the pandemic. And so just the issue around the data preparedness and the ability to supply data that people had to do policy. What are your thoughts around that, or what did people talk about?
So that's a great point, and it's accurate. So this is I'll sort of have my Sequoia hat on here, as well as my many years spent in public health hat on as well. But the Emergency Preparedness Information Work Group that's been convened by Sequoia, and that is under our Interoperability Matters program, that's part of Sequoia. That we have brought together subject matter experts around that very topic that you're mentioning there, to discuss and recommend changes and improvements and some flexing and pivoting at the state and local level, and also at the national level. And that's what our deliverable is about in terms of recommendations. But the point you make regarding access to data, whether the data is quality or not, is one of the sort of categories of recommendations that the work group was able to put forward last week, or earlier this week, actually. I just got back from Atlanta at the summit. And to your point, when the pandemic initially started, actually Sequoia received outreach from several states asking about, is there any way you can help in terms of national networks or Sequoia's work to provide better access to data. So what we did find is that, it's especially at the public health level, where they're collecting information in terms of vaccinations and contact tracing information, demographic information, even additional clinical information around COVID positive patients in order to provide better care. Public health was struggling with that. And one of the reasons public health struggled with that is because of the concept of minimum necessary under HIPAA. And HIPAA says that for public health, the public health use case, you only receive the minimum necessary data in order to implement a public health program.
Mm-hmm.
So therefore, public health was struggling with getting additional clinical information about the patient or getting demographic information about the patient. So Sequoia was able to make some recommendations at the national level to sort of ease that requirement somewhat so that states could receive, public health in particular, could receive the data that they needed. So the recommendations, some of the recommendations in the report that we were able to present at this week's Public Preparedness Summit have to do with not just access to data from a technical perspective, but access to data from a policy and regulatory perspective. So with technology, you can pretty much do whatever you need to do if the only thing that's governing that is technology.
Mm-hmm.
But in states and locals and at the national level, there's governance and there's law and there's policy around who and what and how you can access data. And the policy issue is one of the greatest that needs to be overcome in order to open up the flow of data so that if we are in a position where we're responding to something like the pandemic, as we are now, we're in a better position to allow those who are responding to an emergency like the COVID pandemic to have access to the data and the quality of data that they need in order to respond. So I think I think this is a double-edged sword in that, we did, to your point, as the pandemic came into being, we did open some doors that, were not so great in terms of, public health doesn't necessarily work this way, or interoperability doesn't necessarily work the way we need it to. So that's been, I would say difficult to sort of traverse through. However, what this has done in a really positive way is shine a spotlight on that and shine a spotlight on the fact that there are opportunities for us to modernize our emergency preparedness tools at the state and local and national level. And this is really the opportunity for us to take a good hard look at that. And Sequoia is hoping to be a part of that by convening this work group and working with these subject matter experts to put forward recommendations that will hopefully benefit the entire country.
Well, first, let me say to our audience that may just be joining us, this is Jim Tate of Tate Chronicles, and my guest today is Debbie Condrey, Chief Information Officer of the Sequoia Project. We're talking about TEFCA and the role that Sequoia is playing there, and we're also talking about the recent Emergency Preparedness Summit that was in Atlanta that Sequoia Project participated in. I think in terms of the pandemic and data and policy, very few people, healthcare providers, certainly in the U.S., probably anywhere, had ever been through anything like this. Hopefully it's just once in a lifetime thing. So really, many of the people involved in policy and trying to figure out what to do next is the first time they'd ever experienced it. And so trying to find the right tools. And early on, I can remember the hope was on contact tracing, like it's done in healthcare and STDs, tracking STDs. And I think pretty quickly that contact tracing turned out not to be as effective, either because the virus spread so quickly, or just it was impossible to contact everybody that had possibly been exposed. So I don't think we're hopefully not too early to start coming up with some best practices. And I believe that there is a white paper out there. Let me see. Yep. That Sequoia put together. I believe is the Emergency Preparedness Work Group Pandemic Response White Paper. Do I have that right, Debbie?
Right. That's correct.
Yeah, I read it last night. It's really good. It's the best thing I've read so far that starts addressing what we've just been through and best practices, lessons learned, things like that. I was able to find it at the sequoiaproject.org website. I guess that's the first place for people to go download it. And I recommend they do. There's a lot of meat and very little fluff in this white paper. It definitely is important, and thanks for Sequoia putting that together. So you've been involved in this. Sequoia has been involved in this emergency preparedness, big role in TEFCA. Is there any other large projects Sequoia is involved in right now we should maybe know about?
Well, Sequoia is really good at sort of putting forward interoperability projects for public good and incubating those projects and then implementing. So we really are about not just producing white papers, but we are about implementing activities that make a difference. So one thing I will mention is that as to just sort of follow up on this emergency preparedness work group deliverable white paper that you were able to download and read last night, which we appreciate. The work group is going to be coming forward with specific deliverables and recommendations around the first item we're going to work on is the public health emergency preparedness technology tools toolkit, and that will be coming out this year.
Okay.
We'll also be working on a policy roadmap for data sharing for state governments and for emergency preparedness as well, which we have a lot of interest in statewide. We had a lot of interest in that at the Preparedness Summit. So those two follow-ups to this paper that you just read will be coming soon, and will be really specific, helpful tools in terms of providing health IT interoperability going forward.
You know, there's something else that I imagine the Sequoia Project was related to TEFCA. Sequoia was involved with is recently there have been a couple of webinars that are not for providers so much. They're really for organizations that might want to be one of these qualified health information networks, what it's about, how to apply.
Correct.
Is that also recorded? Those recordings available at the sequoiaproject.org website?
They are, and there will be ongoing workshops as well for those who wish to participate. We do have a couple of new work groups coming up as well for consumers and other stakeholders who are interested in interoperability and health information exchange. So those are coming forward in the future as well.
Debbie, I've got one more question for you. And this is a question I like to ask anybody who's been involved in interoperability. I can remember paper-based systems. I remember when the first faxes came in. We thought that was miraculous that you could fax a medical record. And that was like ground zero of the trajectory of interoperability. So we know where he came from, and we know where we hope to be sometime in the future. How far along are we? Are we halfway to that, to the Goldilocks vision of right data at the right place at the right time?
I think we are. I think that we found during the response to the pandemic that there were many areas that were still using fax machines. I think we have a little bit of ways to go, but I think things like programs like TEFCA and especially those that are government sponsored through the ONC and are moving us forward. It's going to take some time still to get us away from fax machines and away from paper and exchanging in an electronic way. But we are definitely on the move, and I think with some hard work and focus on interoperability, we will get there.
There's definitely movement. I couldn't agree with you more. Well, to our audience, the clock on my wall says it's time to say goodbye. So let me say thanks to everyone who's listening for joining me on this episode of the Tate Chronicles. I offer a special salute to my guest today, Debbie Condrey of the Sequoia Project. Debbie, thanks for coming aboard today.
Oh, thank you so much for having me.
You can find more information on this show's program page at healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors.
Tape Chronicles transmission ending now.